Welcome to the Inside Biology. The science of a woman's first intercourse differs greatly from movies and myths. Let's uncover the evidence-based truth, empowering you to approach this milestone with confidence, not fear. First, there's no normal for first-time experiences. Every woman's body and emotional journey are unique. We'll equip you with scientific knowledge, replacing anxiety. The biggest myth, that first intercourse must hurt. Many expect pain as inevitable. But research shows pain isn't biologically necessary. When it occurs, it's usually due to addressable factors: insufficient arousal, lack of lubrication, anxiety, or rushing. Let's demystify female anatomy. It's empowering. The vulva includes external parts like the mons pubis, labia, clitoris, and vaginal opening. The vagina is the internal canal. Crucially, it's a dynamic organ, not passive, changing dramatically with arousal. Arousal brings physiological changes. Blood flow increases, making tissues swell and sensitive. The vagina lubricates throughout its length via transudation. The vagina also lengthens and expands. The upper two-thirds balloon outward. This process, called vaginal tenting, prepares the body for comfortable penetration. Arousal is physiologically necessary for comfortable intercourse. Without full arousal, the vagina stays shorter, narrower, and less lubricated. Penetration then is like trying to put on a shoe 2 sizes too small. Let's demystify the hymen, a misunderstood part of female anatomy. The hymen is a thin, elastic membrane that partially surrounds the vaginal opening, naturally allowing menstrual flow. Hymenal tissue varies greatly. It can stretch or tear from non-sexual activities like sports, tampon use, or even normal development. Crucially, a hymen cannot determine someone's sexual history. Medical organizations, including the WHO, confirm this, calling for an end to virginity testing due to its lack of scientific basis. The idea that the hymen breaks during first intercourse, causing bleeding and pain, is a myth. Many don't bleed, and its presence or absence tells us nothing about sexual history. Sexual response isn't just physical, it's a whole body, whole brain experience. Understanding its neurological and hormonal aspects helps explain why first-time experiences vary so much. Arousal begins in the brain. The limbic system processes stimuli, triggering feel-good chemicals like dopamine and oxytocin. These create pleasure, motivation, and bonding. But here's the catch for first-timers. Stress hormones like cortisol can interfere. Anxiety or fear can inhibit arousal. This highlights why emotional readiness is as crucial as physical readiness. The nervous system also plays a key role. For arousal to occur, your rest and digest parasympathetic system needs to be dominant. Feeling safe, relaxed, and comfortable is essential. For many, the first sexual experience involves a complex mix of excitement and anxiety. The brain sends mixed signals, excited by the new, yet worried about pain or judgment. This normal neurological complexity explains why first experiences can feel intensely emotional even when physically comfortable. The psychological aspects of first-time intercourse are as vital as the physical, profoundly shaping the experience. Expectations, anxieties, and self-image are key. Many women feel pressure for their first sexual experience to be perfect, yet high expectations often lead to disappointment. Anxiety is common and normal before first-time intercourse. Worries about pain, body performance, or a partner's reaction are natural, not a flaw. Self-image is crucial. How you feel about your body, sexuality, and right to pleasure influences your experience. Positive body relationships and believing you deserve pleasure lead to better first experiences. Crucially, readiness isn't dictated by age, peer pressure, or a partner's desire. Sexual readiness is deeply personal. Emotional readiness means body comfort, processing negative messages, communicating needs, and genuinely wanting the experience for yourself, not to please others. Before first intercourse, cover consent and communication. They are vital for positive sexual experiences. Consent isn't a one-time yes, it's ongoing. You can change your mind, express desires, set limits, or stop. Effective communication means expressing desires, boundaries, and concerns. Though it may feel awkward, good communicators have more satisfying sexual relationships. Before your first experience, discuss expectations, boundaries, and concerns. What excites or worries you, your desires and limits. These conversations evolve. Also, discuss practicalities, contraception, STI testing, and what to do if uncomfortable or wanting to stop. These talks build trust and safety for true intimacy. A partner who respects your boundaries and communicates is worth intimacy. One who pressures, dismisses concerns, or makes you feel bad isn't ready for sexual intimacy. First-time intercourse isn't inherently painful. While some discomfort is possible, significant pain indicates an issue. Pain often stems from insufficient arousal, lubrication, anxiety, rushing, or underlying medical conditions like vaginismus. Crucial foreplay isn't just a few minutes. It might take 20 to 45 minutes to achieve full physiological arousal. Adequate lubrication is essential. Even with natural arousal, high-quality personal lubricant enhances comfort and pleasure. There's no shame in using it. Penetration should be gradual. Many start with fingers, allowing muscles to adjust. The receiving partner controls pace and depth. Position matters. Positions giving the receiving partner control, like on top or side by side, are often best for first experiences. Pleasure is as vital as avoiding pain. First-time intercourse should feel good, not just be gotten through. If it doesn't, pause, adjust, or try again. For a positive first-time experience, emotional context is as vital as physical preparation. Feeling safe, trusted, and ready forms the foundation. Trust means confidence your partner cares, respects boundaries, and won't judge or pressure you. It builds through consistent, respectful behavior. Safety is multidimensional. Physical safety means confidence your partner won't hurt you and will stop if asked. Emotional safety means feeling accepted. Sexual safety, protection from STIs and unintended pregnancy. Discussing precautions is caring and responsible. Emotional readiness can't be rushed. It means comfort with your sexuality, processing negative messages, genuine excitement, and ability to advocate. There's no universal timeline for sexual readiness. Some feel ready at 16, others at 36. Readiness isn't binary. It's a complex mix of physical, emotional, and situational factors. First-time sexual experiences are profoundly shaped by cultural and societal messages, often unconsciously influencing expectations. Many cultures place enormous significance on virginity, especially for women. This concept is a social construct, not a biological state, with no scientific basis or physical marker. It creates harmful pressure, making first experiences feel like a loss, performance, or anxiety. Media often portrays first sex unrealistically, either perfectly romantic or traumatic with little middle ground. Real experiences are far more complex than these portrayals suggest. Cultural messages about female sexuality are particularly damaging, presenting contradictory expectations. Be sexy but not sexual, desirable but not desiring, experienced but not too experienced. These double standards create confusion and shame. Navigating diverse religious and family values while forming your own sexual identity is challenging. Honor your background while making choices that feel right for you. Understanding these influences helps distinguish your true feelings from external expectations. Your sexual choices should be based on your own values, desires, and readiness, not cultural pressures. What happens after first-time intercourse is rarely discussed, yet crucial for processing the experience. Physically, mild soreness is common, resolving in a day or two. Significant pain, unusual bleeding, or infection signs require a healthcare provider's consultation. Emotionally, reactions vary widely, from elation to feeling underwhelmed or a complex mix. All are normal. High expectations often make the ordinary reality feel anticlimactic. You might feel closer, unchanged, proud, confused, relieved, or excited. It's normal to have questions like, was that normal? Seek accurate information. Remember, it's just the first time. Like any new skill, sexual intimacy improves with practice, communication, and exploration. Your first experience doesn't define your future. Even if your first experience wasn't positive, future ones can be. Factors like anxiety, inexperience, or poor communication often improve over time with the right partner. As we conclude our exploration, remember, knowledge empowers you to make informed sexual choices. Understanding your anatomy, arousal, and emotional needs puts you in control. Base decisions on science, self-knowledge, and your values, not myths or others' expectations. Sexual wellness is an ongoing journey. Keep learning about your body, desires, and boundaries. Prioritize checkups, open communication, and staying informed. Seek help if needed. For pain, sexual response concerns, or anxiety trauma, specialized healthcare providers and therapists can assist. Your sexuality is yours. You decide readiness, desired experiences, and boundaries. You deserve partners who respect and support your well-being. Your sexual journey is unique. Don't compare your experiences to others, friends, partners, or media. Your timeline, experiences, and feelings are valid. Science shows knowledge, confidence, and self-compassion lead to positive sexual experiences. You deserve safe, consensual, pleasurable sex. Armed with accurate information and commitment to well-being, you're equipped to create that life. If you want to learn more about sexual health, anatomy, or relationships, seek out reliable resources. Trusted websites like Planned Parenthood, the World Health Organization, and American Sexual Health Association offer science-based information. Many countries also have confidential hotlines and clinics where you can ask questions without judgment. If you ever feel confused, anxious, or have concerns about your body or sexual experiences, don't hesitate to reach out to a healthcare provider or counselor. Sexual health professionals are trained to help, and your questions are always valid. Remember, your first time is just one step in your lifelong journey of self-discovery. There is no single right way to experience intimacy. What matters most is your comfort, consent, and emotional readiness. Trust your instincts, communicate openly, and prioritize your well-being. Keep learning about your body, your desires, and your boundaries. Be patient and compassionate with yourself. Every experience, whether positive or challenging, is an opportunity for growth and understanding. Thank you for joining us on this journey. Remember, your sexuality is yours to define. Stay curious, stay empowered, and know that you deserve respect, pleasure, and happiness in every aspect of your life. Like, share, and subscribe for more educational content. Thank you for watching.